39-year-old Juma Musoke is a boda rider from Wakiso district. He was among the scholars who started their day at Kiswa Health Center in Bugolobi with the hope of receiving COVID-19 jabs.
I came with hope of being vaccinated, but haven't been vaccinated. I'm told they follow a process. We were told to come early. We were told to come as early as 7 a.m., which we did, but I wonder why doctors are not enough. We have to go to work. I've decided to get vaccinated because of the president's message. Vaccination cards may turn out to be essential.
Just like Musoke, dozens more were seen stranded at this vaccination center. Only a few were called to receive vaccination cards. Our crew arrived at China-Uganda Friendship Hospital in Naguru at noon. The day's vaccination exercise had stopped. The receptionist intimated to us that the exercise runs from 7 a.m. to midday and usually covers between 200 to 300 people. In his New Year's message, President Yoweri Museveni directed public transport operators not to admit passengers who are not fully vaccinated. He also urged fully vaccinated people above the age of 50 to get booster jabs since vaccines are in full supply.
The 50 years old plus persons that have already received 2 doses come out again for the booster dose. I will soon be going out for mine. And Mama here, we shall be there for the booster. Because they are saying we need the booster now.
The Ministry of Health has also announced intentions to give booster shots to medical workers and ready citizens. Speaking to CTV last Wednesday, the Secretary General Uganda Medical Association, Dr. Albert Ruswata, said blaming the public for delayed vaccination is mere politics.
Many people come to be vaccinated, but some are vaccinated and others go back home without actually receiving the vaccine here in Kampala. So how can you say that people do not want to be vaccinated, and yet when they come, many of them actually are not able to access the vaccine? So it is not true that Ugandans actually don't want to be vaccinated. It is the vaccine which is not enough. The vaccines are not yet enough. And actually, I would wonder, why would you send vaccines to an area where people need to be forced to be vaccinated, and yet there's another area where people are just fighting to get this vaccine? First, concentrate on those ones who are yearning to be vaccinated. And when you see that they are over, like here in Kampala and other cities, then you can look for those ones who are just running away from the vaccine. So it is not true.
The director in charge of public health at Kampala Capital City Authority has deferred our questions on whether there are available vaccines for Kampala residents until he returns to office.
I said I'm not in office today, I'll be in office tomorrow.
Shamim Natebwa for CTV PM Edition.